Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 612. And today we'll be talking with Dr. Kinny Edmunds, my new associate. Before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to my office Facebook page and like us, that would be awesome. Also, all past episodes, complete with video, are available at thereasonswesmile.com. Okay, I want to remind you that you're going to have a chance to win free flowers from DeSantis Florist. That'll take place in about 10 minutes. If you want to pre-program the number into your phone, it's 614-459-9769. That's 614-459-9769. In about 10 minutes, you'll have a chance to win. Okay, so Dr. Edmund, welcome back to the show.
Great to be back.
Awesome. So how's it been going?
It's been great. Really good start to this fall.
Yeah? So you're busy?
Yes, been very busy.
I wanted to ask you, how's it been getting used to doing dentistry all day, every day?
It's a big change. You don't know how exhausting it can be till you spend a full week, full-time, working in people's mouths. It's both physically very demanding at times, you know, getting teeth out of the mouth or putting things in the mouth, and it's also mentally challenging. There's a lot that you're keeping track of at the same time. And often you're seeing multiple patients in different rooms, but at the same time, so you really got to have a mindset of, okay, I'm done here, now I'm moving on to this next task, and keeping track of everything can be a balancing act.
Yeah, I did a show once. It was, I think it was entitled, What My Brain is Saying to My Hand. Because when you're working on a patient, your brain is saying things like, okay, don't nick the next tooth.
Yeah.
Make sure the patient's numb enough. Is there enough water? Is the suction on high enough? Or is there too much water for it to keep up? Is the patient comfortable? Not just are they feeling it, but is their neck in the right position? Mm-hmm. All of that, right?
And sometimes patients won't tell you when something's amiss, you know, when they're not completely comfortable. So you kind of have to look for those cues and make sure that you're having an open dialogue with them and that you're keeping them happy and that nothing is painful or uncomfortable.
All at the same time that you're doing something with enough clinical excellence that it would have passed the national board and regional board exam, right?
Right, exactly. So it's a different experience. Every new patient that walks through the door, completely different mouth, new experience.
So you thought dental school was hard?
I thought dental school was hard. Little did I know.
Because we talked about that.
Yeah.
And it is hard, folks, but it's not as hard as doing it for real.
Not even close.
So what would you say on average in your 2 years of practicing dentistry in dental school, how many crowns did you do, for example, in the entire 2 years?
I did 14 crowns in 2 years.
Okay, so you've been a dentist for 3 months. How many do you think you've done?
Well, let's see. Ballpark over 50, maybe just under 100.
Right, right. So
I've done 10 times as many crowns in, a tenth of the time. So
right. And so now you're kind of starting to get it.
Yeah. And you don't know how little you know in dental school till you get out and you start actually doing these over and over and over. And then you start to pick up patterns and things that help you be faster and more efficient. And we did great work in dental school, but I didn't really understand why. I kind of relied on my faculty to tell me, this is what you need to do. And I wasn't really understanding. I was just kind of following directions a lot of time. But now, when you're doing it yourself and you're repeating over and over, you start to understand, oh, that's why they told me to do it that way.
Right. one of the things I do on a crown, since we're talking about crowns, is as early as I can in the process, I put the retraction cord in. That's the cord, folks, that goes around the gum line down at the bottom where the tooth and crown are going to come together, because we need the gums out of our way in order to get an impression, or if I'm using the CEREC machine, to scan it.
Yeah, and you taught me a lot of really valuable lessons. And another thing we talked about was when you need a root canal done, we're also doing a crown that same day. And you taught me that you get the crown ready first, then we have so much more visibility to do the root canal.
Right.
And it speeds up the process and makes it so much more efficient when you're cleaning out the canals of that tooth.
Right. It takes away a lot of the guesswork, because you can look in there and see all three, or if there's a fourth, you can see the fourth canal. There's no question mark in your mind, right?
Exactly, yeah.
Yeah. And so, okay, so now how many patients would you say you're seeing per day now?
So if you count all patients I see, including those who are just there for a cleaning, I'm probably seeing on average 14 to 16 patients a day.
Okay. How many of those are dental that you actually see?
Dental
doing
is
dental
probably
work?
more like 8 dental patients.
So you're
and
seeing
then
8, and then another 8 where
Yeah.
you're checking on hygiene, periodic exam, and cleaning. And so how many patients were in your folder box at dental school? Like how
Let's
many?
see. I think it ranged from about 12 to 20.
That's how many patients you had.
Yeah,
the
those
entire
were
time
those
in
were my
dental school.
active patients in dental school. Yeah. So I could
Now
have
you
seen
see
all
that.
those in one day.
Right. Okay. And so now that you've been in practice 3 months, what is your biggest surprise? We already talked about you were surprised about how you had to use the language of the patient.
Yeah.
We talked about that, but have there been any other surprises that have come about?
You know, one thing that's been really surprising to me is the part of dentistry that we don't really talk about in school, and that's patient interaction.
Right.
That we never
Patient-doctor interaction?
Yeah, patient-doctor interaction. So one thing that's been surprising, and in a good way, is how when you see people frequently, you really get to know them as friends and as neighbors and people who live in your community. And it's just shocking the relationship that you develop with people as a dentist, because you see them so frequently.
Right. I actually did a show, I think it was 10, maybe it was 15 reasons I like being a dentist. And that was my number one favorite reason, was the relationships. So that's really neat to hear you say that.
Yeah, I completely agree with that.
What other profession? Think about it. Let's say you work at an insurance agency. There are 4 people in the office, the owner, an assistant, and a couple of salespeople. They don't interact with anybody but those 3 other people.
Yeah.
Day in and day out for 20, 30, 40 years.
Yeah.
And we have the privilege of meeting new people every day, for one, and also seeing them every 6 months. That's where the friendship comes in. You see the people, and you get to see them every 6 months. You'll get to see, I know it's only been 3 months, but 6 months from now, that the woman that was pregnant is going to have that baby, and you'll be talking about that, right? 6 months from now, the 3-month-old will be 9 months, and they'll be talking about maybe they're crawling.
And I'm already impressed with how I've gotten to know people who have been in regularly, and I haven't even been seeing people long enough to do these every 6-month checkups. I think that will be even more rewarding when I start seeing people that regularly.
And I learned so much from my patients. I love talking to them about what they do, getting their opinion on things. And I'll tell you what, my son, my youngest, has been diagnosed, this was years ago when he was little, as having ADHD. Well, a patient of mine diagnosed that and had never met him. Okay, so we're talking, she was telling me, I can't remember the patient's name because it was in 1980, well, let me think, he was born in 87, so it would have been like 89. That's why I can't remember. But anyway, and she was describing her son or daughter and how they had just figured out that we'll call it a daughter, had ADHD. And I'm just listening, and I'm working, and I'm listening, and I'm placing a filling, and then all of a sudden I go, wait a minute, what was the name of that disease again? You just described my son.
That's fascinating.
Isn't that neat?
Yeah.
And so I went home and I told my wife, I think I know why Tony's a little different than the other 3, why he's not responding to the same discipline, the same order. We raised 3 other kids before him, and yet he didn't seem to want to fall in line,
Yeah.
And so I told her it's called ADHD or ADD. We didn't know which one it was at the time. And so I said, we need to make an appointment with the doctor and tell them we think he might have ADHD. And of course, doctors hate that when you pre-diagnose, right?
Yeah. Can't stand it.
But it's not so simple. The doctor just doesn't say, yes, you're right. The way that works is you have to go, we had to go to Children's Hospital There's this whole department, and they evaluate both the parents and the child. First thing they did was separate us from the child. And I think they had me in a different room than my wife. And they were asking us all questions at the same time. And there was also, it was an all-day kind of a blood test or something where they took blood, did something, took blood again. And so part of it was our son being tested in that way. But it started off trying to figure out if we were just bad parents.
Well, that's amazing that this all started just because of a single patient interaction.
Right. Isn't that neat?
Yeah.
Yeah. So, and I also learn different outlook on topics that I may not have had on my own. And it's enlightened me to see things a different way or to see things from both points of view. You know?
And everyone has things that are important to them. Everyone has stories to tell. And so it doesn't matter who the person is. You can learn something fascinating from everyone that walks in the door.
So I realize that I've been rambling on and that I've probably taken up most of the first segment of the show because, as I mentioned at the beginning, we do Dr. Kvitko's question of the day. And I always try to make the questions poignant for one and easy for another because I know it's early in the morning. So stay tuned because we're about to do Dr. Kvitko's question of the day, but before we do, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
Okay, today we are talking with my new associate, Dr. Kinny Edmunds. The question is, how has his first 3 months in practice compared to his 2 years of seeing patients in dental school? A, in dental school, he did 14 crowns in 2 years, and in practice, he's done between 50 and 100 in 3 months. B, in dental school, he had between 12 to 20 patients in his file box, but now he sees 16 in one day. Or C, all of the above. All right, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said, people don't take the time. Hey, people don't take the time.
Hey, what's going on? It's Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. You can look for my smile courtesy of Dr. Kvitko on the CBS television network where I play Danny on the hit soap opera The Bold and the Beautiful. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go! Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. Okay, we're back. Would my producer please tell me who is the winner of Dr. Kvitko's question of the day, who knew that the correct answer was C, all of the above?
Well, it was Robert from New Albany, so he'll be getting those flowers coming up this Tuesday. Robert from New Albany, the correct answer was C.
Congratulations to our winner. Enjoy those flowers from DeSantis Florist. For those of you that didn't win, please call back next week. All right, if you're just joining us, I'm Dr. Kvitko. This is episode 612 of The Reasons We Smile. With me today is Dr. Kinny Edmunds, and he graduated from dental school, May or June of this year?
Yep, May of this year.
Late May. Okay, so you've been practicing for 4 months, 3 or 4? Well, you didn't really start.
I started early June.
Early June, July, August, September, October. I guess it's closer to 4. I've been calling it 3. But anyway, okay, so what we've been doing is we're trying to find out from him what it's been like to transition from dental school to private practice. And as you know, Dr. Edmunds joined my practice, when was it? Was it July?
I think it was July.
July, that's why I kept saying 3.
Yeah.
3 months. And then over your time practicing general dentistry, and something that I didn't know, right out of dental school, you had thought it might be neat to become an endodontist, to go back and become a specialist. And you were determined to be, the first alternate or something?
Yeah.
Okay.
So the way that specializing works is that you do a residency similar to medicine.
Right.
The difference between dentistry and medicine is that when you graduate dental school, you can immediately start practicing as a general dentist. And oftentimes, dentists will go practice for years before specializing. That's really an awesome way to do things because you get a very good idea of how the whole profession works. Dr. Kvitko, you do orthodontics, you do oral surgery, you do pediatric dentistry, you do endodontics, you do periodontics, and so you can get that broad scope of how all the dentistry works. And then if you do really find out you love something, you can go back to school and become a specialist and then focus the remainder of your career on that specialty. And I was convinced that I wanted to do general dentistry and be part of the whole gambit of everything I was talking about: oral surgery, pediatric dentistry, periodontics. But for a number of reasons, endodontics just really caught my eye, something that I really enjoyed doing. And so I decided, you know what, I think I'm going to look into specializing in endodontics.
So you're thinking about going back to school and learning how to do nothing but root canals?
Nothing but root canals and apical surgeries, which is when you're treating the root tip of a tooth that has had either a failed root canal or other issues.
Right. And you've seen me do some of those, right?
Yeah, I have.
Okay. So it's pretty neat. It's not that hard, but it's something that a lot of people don't do. And
it's something that I would say the majority of dentists will stay away from the harder cases of endodontics because it is something that can be very tedious, and endodontists have specialized equipment that helps them perform these more difficult cases in a more predictable way. The general dentist who isn't doing a lot of root canals doesn't get that experience and doesn't have those technologies and equipment, so it's just not feasible for them to do some of these more difficult cases.
Right, and you're talking about the microscope for one?
Yeah, the microscope,
right?
And 3D cone beam.
Imaging, right?
Which you have in your office.
Right.
And like you were saying, a root canal is very easy. A normal, straightforward, everyday root canal. Teeth have anywhere from 1 to 5 canals. That's the kind of the normal range. And if you have a 1 canal tooth, just about anyone can pick up up the equipment and do it once you've learned.
We could probably teach a chimpanzee to do that, right?
I think you could. But it gets a lot more complicated when we get further back in the mouth. We have patients with medical conditions that make it harder to achieve a successful root canal. And when things go wrong, something breaks off inside the tooth, or there's a fracture somewhere in the tooth, or it's a difficult diagnosis, it's hard to tell which tooth is hurting the patient.
Right.
Those are things that we tend to give to someone with a lot more experience and who has a practice focused on endodontics.
Now, I tried the microscope, by the way, and I didn't like it.
Yeah, I know. You told me that.
You have to be able to see in the hole in order to magnify what you see in that hole.
Yeah.
So maybe they'll spend the first 9 months of of training trying to show you how to focus that microscope.
We used it in school, and it's true. If you can't see the tooth without the microscope, you're not going to be able to see it with it.
And then the other is when you finally can see it, sometimes there's not room for your mirror and your hand.
Yeah.
And your instrument, right?
Right.
At the same time. So a lot of root canal treatment winds up being kind of blind and from touch and feel, right?
Exactly, yeah. And that's where experience comes in as a key. If you've done this, whether it's on a patient or on a tooth that's outside of the mouth that you're practicing on, you have to have the repetition in order to know what you're feeling, what feels right, what feels wrong, and that just comes with time.
Yeah, and you had a root canal I think we touched on it last show that was at the office, and it's a tooth that normally has one canal, and this one had 2, right?
It had 3.
Oh, this one had 3. That's right. It was an upper bicuspid, and I found a third canal.
Yeah, you found that third.
So that would have been
without a microscope.
Without a microscope, and that would have been one that you would have thought everything was fine from the X-ray. You'd have known you'd filled 2 canals, and you'd have thought, great, I'm done. And it could have acted up right away. Could have acted up 6 months, 9 months, a year later.
Yeah.
And you'd still be scratching your head, going, "Wonder why this is hurting."
It looks great on the X-ray. Yeah, what's going on? And see, I would have. Yeah, I needed your experience to get that third canal located because that's the kind of thing I just hadn't seen before.
Right, and you will. And then there are teeth where you have 3 orifices. Orifices is probably not a word, but orifice, like what's an orifice? Yeah. An orifice times 3. Yeah. 3 orifice. And you get all 3 lengths. Everything's fine. You fill, say, the palatal, which is there on the roof of the mouth. Yeah. Maybe you fill the one out by the cheek that's towards the front of the person's head. And then you go to fill the one on the side of the cheek towards the back of their head. And it's like, now that I'm filling it, it only goes 18 millimeters. It won't go the whole 21. Right. And then what you find out with your final X-ray is those 2 canals joined 18 millimeters up and became one. Exactly. But if you don't do enough of it and you don't know what's happening and you don't know what you're doing per se, you'd be scratching your head or looking, how can I get that third canal to go all the way to the end again? Yeah. When in fact you're done. You should stop right there. Right. Right?
And canals join all the time, and you just have to know this is what's happening, this is why I'm feeling that stop, and you have to know exactly the order to fill things so that you get the full solid fill all the way up through the canal, even though they join.
Right, and so if you're listening, folks, these are the kinds of things that we deal with when we're doing a root canal, and it is not an exact science. There is no formula where every upper molar has 3 roots. Yeah. Some have 4, some have 5, some have 6, some only have 2. Yeah. And you can kind of tell, oftentimes it's a wisdom tooth, and the shape of the tooth almost looks like a big bicuspid, and you can look for the third, and I do, but you almost never find the third canal if it's smushed together and looks like a bicuspid. Right. Right. So, and I believe that's why they no longer let dental students do molar root canals in school. Yes. Right? Because there are too many variables?
They're so commonly come back with missed canals, and it's a big headache if you don't have the experience and the training to find those little canals. Once you've accessed canals, that's when endodontics is easy, right? Because you can see exactly what you're working with, or at least feel the location. And then it's just, then there's a formula. We clean it out.
Do this first, do that next.
Irrigate it, we fill it up. But getting to that point is what makes it hard.
You mentioned earlier about one of the advantages or one of the advances in what you will learn in endodontic residency is the cone beam scan. So what we want to do is talk about that a little bit more when we come back from the break, okay? Great. All right. So you're listening to The Reasons We Smile with Dr. Kvitko, episode number 612, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, We're back. If you're just joining us, I'm Dr. Kvitko. This is episode 612 of The Reasons We Smile. We've been talking with Dr. Kinny Edmunds, and he's my associate, but he just let me know, probably a month or so ago, that he has decided he wants to be an endodontist, so we think that's really cool, and, people have to follow their passion. You want them to be happy, and he's not done with us yet. We're not done with him yet. He's going to fill in on occasion as needed once he does get into his specialty training, and we already have a date or two scheduled.
Yeah, we do. And it's a really hard decision, because when you specialize, that's kind of the focus of everything you're doing, and you're giving up some other things in order to do that. And I'm happy with my decision. I know I'm doing the right thing for me, but it is a tough thing to decide. So it's nice that at least I have the next few months to year to stay involved with you and with your practice and your patients. I think that's really important to me.
And some general dentistry in there.
Yeah.
And so we were talking before the break about, you mentioned how the cone beam scan was a new adjunct for endodontics, and I have the machine. And tell me about that. I mean, if I'm right, let me just tell you, my thought is you can take a cone beam and you can see if there are 4 canals before you ever start,
You
correct?
can see everything there is to know about the tooth.
As you pan through it.
As you get different slices. So when you see your x-rays at a dental office, you're seeing a 2-dimensional representation of a 3-dimensional object. Well, with this cone beam imaging, we can actually see the 3D. So instead of just one view, we can see every view all the way straight through the tooth. So if there is that strange canal that, we're not sure is there or is not there, the cone beam will tell us, yes, in fact, it is there. And not only is it there, here's right where it is.
Well, and those canals that I said joined sometimes, you'll see that too.
Yep.
Because as you pan through, you'll start off with, say, 4 orify. And then as you pan upward towards the root end, I'm talking about an upper tooth now, you'll see that 4 disappear into 3 if the 4th one connects to one of them, correct?
Exactly.
Now, cone beams are not inexpensive, though. Would it be
No.
something that you plan on factoring into the price? Will every root canal cost more, or will everybody have to submit to a cone beam prior to having their root canal?
It's becoming more and more common among endodontists to have the cone beam factored into the price of the root canal. So instead of charging a fee on top of it, it's just assumed, hey, this is my fee for a root canal, and factored into that is this cone beam imaging.
Okay.
Because it is very expensive.
Yeah, it's about, I think, and we can't charge any less. We'd love to, but the machine was $189,000.
Yeah.
And I think we charge $454 when we use it.
You could almost send someone to dental school for that.
For $189,000. Yeah. Luckily, we have financing available, because I didn't have $189,000 sitting in my pocket, as you can imagine.
If
and
only.
So been making payments for a long time, but it's all about great care, right?
Exactly. And that, it's hard for patients to understand that. And it's an important thing to understand, is that a lot of the cost is factored into these huge purchases of really important equipment. And we can't, once we have the equipment, then yes, using it again costs very little. But that initial upfront cost is so expensive, we need to pay that off with how it's utilized by patients. So the fee involved is very worthwhile to each person who's paying it, because it's so important in our diagnosis and our treatment for each patient.
And the extra cost you mentioned for having the cone beam involved in having your root canal is if you can successfully do a root canal on a tooth. That means you can save the tooth, which means you don't have to pay for a replacement, which is a lot more expensive typically than saving the tooth.
The original tooth is always better.
And
If we
it's-
can save it, we want to save it.
And it's the cheapest.
It's worth saving,
Because you got it for free at birth.
Yes. It's given to you.
All right. Hey, Dr. Edmunds, it's been really great having you on the show, and maybe we'll have you on again, maybe once you're doing your training or something.
Yeah,
Maybe I can even come and do a remote where you show me around the endodontic residency clinic or something.
I think that would be really fascinating.
Okay. Sounds cool. All right. Well, again, thanks so much. You have a great day. Wish your wife, Chrissy, good luck for me, or good wishes from me. What am I trying to say? Tell Chrissy I said hello. How's that?
Will do.
And Mindy, your daughter. Oh, when's the other one due?
December 2nd, so a couple
just
months.
a couple months.
Yeah.
Wow. Okay.
So we're excited. Well, hey, have a great Sunday. Thanks for having me on.
Okay, thank you. Bye now. Well, folks, that's all the time we have. Thank you so much for joining me. Don't forget to follow me on Twitter at Dr. Kvitko and visit my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588,